Subscribe to our YouTube channel and don't forget to press the bell icon to get our latest updates.
I think there's one question: are sleeping tablets okay when on dementia medications?
Again, sure, I'll answer that question. They are not useful in routine prescriptions for people with dementia, because sleeping tablets per se cause a lot of problems. One, because they cause falls. People have noticed that when they are on sleeping pills, there's lots of research done across the world. We have solid evidence base to say that using sleeping pills like benzodiazepines actually makes a person increases the risk of falls for them, which potentially, when someone falls at that age, they can break their bones, particularly their hip bones, which again causes a lot of further complications later on. So that, and then also it makes them drowsy during the daytime. So we will find that when people, often they are used because people are not sleeping well at night. And when we use sleeping pills like that on a routine, of course there are certain cases or certain patients for whom these can be helpful when everything else has been tried and nothing else works, and they have to be tried under medical supervision carefully. But a routine use of use of sleeping pills for someone with dementia is not something that I would advise, because one, they cause daytime drowsiness, which decreases their ability to...
Somebody is asking, my mother constantly asks for tablets. Should I be giving her a placebo?
Again, there is no blanket answer, yes or no to this. I would advise against it as a routine practice. We may have to, rather than just looking at it on its surface, asking for tablets, we may have to go a little bit below and see why they're asking for the tablets. What purpose does it serve here? Is it anxiety? Is it need for getting someone's attention, or is it need for engagement? It could be a variety of needs that could be driving this particular behavior. So it's important to understand that and address at its root this particular issue. Of course, you could temporarily try and give her tablets or any placebos. I don't know what placebo is available that you could use. I would be very careful about giving vitamin supplements or and things like that, because they themselves potentially can create problems. So we have to be very careful about using medicines without proper medical advice. So just rather than looking at any behavior, rather than just look at behavior at its surface, we'll have to look at what's driving that behavior. What is the reason this person is showing this behavior? And if you understand that, and if you can address that, that will solve many issues later.